And good afternoon and welcome to Straight Talk. This is your Drive at 5 show. Catherine Tyson, your host. How are you guys doing this afternoon? It is Monday. And so that would mean that you had a great weekend and you're up and about now and you're back to work and you're on your way home. And, hey, we're in the tropics. We're just blessed. So we just have to stay blessed and just stay thankful for our conditions. It is beginning to look a lot like Christmas. I'm going to say it, even though in the US, generally, they're waiting for Turkey Day or they're waiting for Thanksgiving Day. But I know one thing, I start seeing all the bright lights all over Cayman way before Thanksgiving. I have seen some beautiful decorations in homes on Facebook. People are putting it on. Let me tell you, it has been something else. And it's such a beautiful time of year. And I really, really believe it is a beautiful, 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 beautiful time of year. It is my birthday month, so of course I'm a Christmas baby. I'm a December baby. That makes me a winter baby, and so I'm just always very psyched when December and Christmas is around the corner. So get ready for Christmas. Calm down, of course. That's what I'll say. Don't overextend yourself, parents. Don't forget that you've done everything in the last 11 months. Don't try to do it all in that one month. Don't get all stressed over about the gifts and the toys and the stuff. Stop that. It really is all about love. It's about taking care of each other and being there and being there for each other and just getting to this side of our pandemic. And so be thankful, and that's what I would say. So good afternoon, and thank you so much for joining the show this afternoon. It is Medical Mondays, and so you know what that means. Medical Mondays is brought to you by Health City, and so we will be chatting with good folks from Health City this afternoon. We have, of course, Tiffany Dixon Ebanks, who's our marketing and sales manager. She's going to correct me in a minute, and that's great because that's what we need. Hi there, Tiffany.
That's okay. You can call me anything you'd like.
Is that kind of what is it?
Yeah, global sales and marketing manager.
That's right.
It's good to be in studios again. So thanks for having us as usual, Catherine.
Yeah, and you know why I'm mixing it up. Now I'm supposed to know because obviously I've had you in the studio many times, but because I was expecting Shamari, you sent the paper on saying Shamari was going to be here.
Yes.
So I had information about him there. But yeah, definitely, Tiffany, you have brought with us this afternoon Dr. Haraz. Is that how we say that?
Yes, exactly.
All right. Okay. Well, good afternoon. And he is the consultant urology and kidney transplant surgery, right?
Right.
That's the area you're in. And so we're talking about Movember. So let's talk about that a little bit. Tiffany, introduce that for us, please.
Yes. So during the month of November, which is Movember, we observe Men's Health Awareness. So I'll share with your listening audience. I asked Dr. Perez, where's his mustache? He doesn't rock the mustache, but I know that there are a number of men in the Cayman Islands and across the world who have grown their mustache this month in honor of, men's health awareness. And so on to bring about more of an awareness with regards to men's health issues. So we have invited Dr. Perez here today. He, as you said, Catherine, he is our consultant urologist, just to join the conversation to talk to us. Now, as usual, we sent a bullet list of all the different topics that we would like to cover today.
Right.
So I'm not going to steal any of that. Dr. Perez is the professional, and he'll be able to talk to your listeners this afternoon about various issues, from cancer prevention to detection to just general men's health issues with regards to treatments, different types of surgeries, and just general healthy living for our men.
Right.
And so happy to have him here this afternoon just to talk through those.
All right. And so, that's always so important, right? Because our men are generally, and Dr. Powers, you can kind of, attest to that. Our men are generally the people that are the most apprehensive about going to the doctor. Is that true?
Yes, exactly.
Okay.
And I am no exception.
Okay, you see, and that's honesty. At least you might have a few friends that you can go and feel comfortable, sitting with. But let's talk a little bit about about some of these topics that you've obviously come in to talk about this afternoon.
Stick
Yeah.
a pin just before Dr. Perez gets into the meat of the matter this afternoon. I just want to introduce him properly
Okay.
to your audience. So he's been in the Cayman Islands for the last 9 months.
And he's been in the studio before too.
Yes.
Like in fact,
Like when he had just come on
in
island.
fact, he's the winner. He's the winner of the
Most views.
viewers.
Yeah.
I think
I
it's
remember
like
that.
over 1,000 views, right? I think every single person that you know in India was tuned in. So let's see. There's two of them
I'm
today.
famous.
Yeah, I
You're
think.
famous in India,
Yeah, I
okay.
think because when he had just started, all of his family and friends were excited to hear he was going to be on the radio, so they all tuned in. So
Yeah.
yes, he did have a fan club. I'm sure you still have a fan club today. They're probably missing you more.
Well,
we haven't.
they've gotten used to him not being there. too,
Yes.
Right? Yeah.
So, Dr. Perez is a trained urologist and kidney transplant surgeon. He brings with him over 7 years of experience in this field. He graduated from Apex Medical Institute in India, and he has experience in prostate cancer research, robotic cancer surgery, and its outcomes. And he obtained his super specialty degree in urology from Postgraduate Institute of Medical Education and Research in India. So before coming to Health City, he was a consultant in urology and kidney transplant surgeon um, at the Narayana Super Specialty Hospital in India. So he brings with him a wealth of experience, many different surgeries. I know our figure that we've posted on our website, he has performed over 3,000 surgeries, and I know that's 3,000 plus 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 now that you've been in Cayman, and you've also had the opportunity to work with the team here to bring a better quality of life and health to patients here in Grand Cayman.
Yeah.
So,
Welcome
without further ado, just wanted to introduce him to your audience, and then he'll be able to take us through some of the more medical matters that I wouldn't be the perfect candidate to do that as a layperson myself.
All right. So today we're talking about Movember, and we're observing Men's Health Awareness. So let's talk a little bit about some of the male health issues that you find, and some of the things that we can really do to promote our men's health.
Okay. First about November itself. What is
Yes.
it? So it's actually a movement, I can say, that was started in Australia about 18 years ago. So Mo is like a short slang for mustache in Australia,
Okay.
and they combine it with November to form Movember,
Right.
and with the slogan that they wanted to change the face of men's health. So literally, they asked men to grow mustache to change their face. That would lead on to discussions about why the hell are you growing a mustache. So and then the discussion can be carried on forward concerning the male health, men's health.
Okay.
So that was the idea that it started off with,
Right.
and it has become a global phenomenon now, with November being dedicated to the month to raise awareness for men's health,
Right.
and to raise money, and to spend it on health awareness and cancer prevention for men.
Okay. All right.
So there is a foundation called Movember Foundation, which actually focuses on three main areas. That's prostate cancer, testicular cancer, and mental health. In fact, uh, in Cayman also there is a wing of Movember Foundation, and a few days ago I heard on radio that they were organizing a fundraising activity, and they were donating it to the Cancer Society
Right. Right.
for the uh, cancer prevention. Uh, Actually, 19th November is also celebrated as the International Men's Day, and we've just it's 22nd, so it was 3 days ago. So this is why I think this month is good for this kind of talk.
Right, right. No, absolutely, absolutely. And so some male health issues that we can think about: cancer prevention, prostate and testicular, like you said, mental health, substance abuse. suicide prevention. That's something I think that is huge, right? Especially in the times that we're in right now, too. We're concerned about one particular thing, but then there's all of these other areas that might get overlooked. You
Right,
agree with that?
absolutely. Yes.
Yeah.
So, like you started off with cancer prevention. So, men specifically, there are two organs in men. Uh, so not there in women. So the prostate and testis. Uh, Talking about testicular cancer first. So it's a cancer of young age. Uh, in fact, 15 to 34 is the age group which is affected by testicular cancer.
Okay.
After you cross 34, 35, you are actually sort of immune to this cancer because there are very less chances. We don't know the reason, but we have found very less incidence of cancer beyond 35 years of age.
Oh, testicular.
Testicular,
Yeah.
yes.
Okay. Okay.
So it's a young age cancer, and it is one of the very few cancers that we can check ourselves. So like women can check their breast for cancers, men can check their testes for cancers.
Okay.
And this is one kind of cancer which used to be very deadly before, but now we have good treatment and very high rates of cure for this cancer at all stages, in fact. But if it is detected early, then even higher, more than 95% chances of cure for this cancer.
Okay. And if you and to check for it, it's just if there's any abnormalities or anything,
Yeah, it's a
right?
simple way to check it. You can do it once a month. Hot shower is the best place to check for it
Okay.
because heat, it lets the scrotal muscles relax and testis hangs down and you can feel it. The men can feel it well.
Okay.
Normally the testes are smooth, firm, and sensitive. But if you find any lump or swelling or pain while feeling the testis, then that can alert to something wrong going on there.
Okay. All right. Okay. And so, so that's like you said, that's more of a young,
Yeah, that's
for yeah, yeah. Okay. And so for men, then I mean for older men, then would be the prostate.
yes.
Can you talk a little bit about that?
Yes, sure. So for prostate cancer, there are see prostate is an organ which is important for reproductive purposes because it secretes fluids that nurture sperms and helps in sperm delivery, semen. Uh, but its location is such that it is just below the urinary bladder, uh, enclosing the urethra on all sides. So when it grows inside, it presses onto the urethra and causes difficulty in urination. So with the cancer also, the cancer makes it grow and cause these urinary symptoms. So these are the first symptoms that actually can suggest the person may be having prostate cancer.
Right. Okay. Okay.
Uh, Regarding prevention of the same, there is no definitive diet or exercise or medication plan that can be used to prevent prostate cancer, but one should be aware of the risk factors of prostate cancer. So if you have family history of one, uh, like any of your siblings or elder siblings or father or grandfather, if they've had prostate cancer. Also, if you have family history of breast cancer, that can predispose you to have prostate cancer.
Okay.
So all those who have family history, we advise them to get their PSA checked starting 40 years of age.
Right. And that's a simple blood test.
A simple blood test, very easy to get it done. And if you do not have any of such risk factors, then we advise to get it after 50 or 55 years of age.
Okay.
So the prevention for prostate cancer is basically the screening with PSA to detect it as early as possible and to cure it if detected early.
Okay. And there's also a prostate biopsy.
Yes.
So how is that? What is that process?
So based on the PSA, if the PSA is high, so normally we say that any value below 4 units is normal. Anything above 4 units requires further investigation. So prostate biopsy is a tool to diagnose prostate cancer. So you have to take a small tissue from the prostate and send it for microscopic examination to see if there's cancer in it. That is advisable if we strongly suspect the person is having prostate cancer. Not all people having PSA more than 4 will be having prostate cancer.
Right.
So between 4 and 10 is a gray zone where we can think of other diseases of the prostate, especially uh, BPH, that is benign prostatic hyperplasia. So it is an age-related thing. All men are predisposed to this, but mostly 50 to 60% of men will have definitely growth in the size of prostate after they cross 40. And if the growth is too much, it can cause very high PSAs based on the size of the prostate itself.
Okay.
The
Okay.
other things is any prostatic infection, any urinary infection, any placement of catheter, any or urinary retention. All these things can also lead to rise in PSA. So having a PSA more than 4 is not the straightforward indication to have a biopsy.
Right.
We have to rule out other causes of prostate, and in a lot of cases, we do give a course of antibiotics to clean off any infection in the prostate that may be causing the high PSA, and do a biopsy if the repeat PSA is still high or it shows a rising trend.
Right. I mean, it just sounds, whenever I talk about this issue, you know, when we're talking about kind of attention on men's issues, I always think about, women that are listening to these programs to ensure that they're getting the men in their life, to be aware and to get this stuff checked out, right? Because that's really important. And I think that, women can kind of put a fire under our men, our sons, or, brothers, or, grandparents, husbands, partners, you know what I mean?
Yes, exactly. We were
Yeah.
discussing a few minutes ago that men do not like to go to doctor. So you have to have your woman forcing you to do that.
Right, right.
Right.
Okay, I have a question. So it's hello panel. If a younger man under 40 is having difficulty urinating and has prostate issues in the family, why is it that MDs are turning them away, citing they are too young? That's a great question.
So difficulty in urination, it encompasses a lot of different things. Uh, Normal voiding is a very coordinated effort of the bladder, the pelvic muscles, and prostate to make the urine flow out normally. Uh, we don't realize it that it's a complicated thing because we all do it very easily. But actually, it involves uh, a good amount of pressure to be generated by the bladder muscle to push the urine out, the adequate relaxation of the prostate and the sphincter muscles that are there in the pelvic floor,
Right.
and then only the urine comes out. A young person having any problem in urination can have uh, a problem with bladder, problem with prostate, problem with sphincter. So that person needs some sort of evaluation. The urologist is the best person to look at that. He may not be having any prostate issues, but it may be other things that may be involved.
Yeah. So I appreciate what you just said about a urologist, because I think sometimes what happens in instances, even with the is that you might go to a general practitioner and then you kind of get that advice. Oh no, it's fine, But it's up to you to say, you know what? I think I need to be, referred to a specialist in this area. Like because I think at the end of the day, you know your body,
Right.
and you know if something feels different, and if you go to a doctor and they keep saying no, nothing's wrong, you're fine, you need to continue to get to the bottom of it, because sometimes when you just leave it alone, it could be it turns into something much worse. Had you dealt with it earlier, it would have been, just we took care of it, it's done, it's not an issue now. But by leaving it, sometimes it ends up becoming more
You're absolutely right,
serious.
because voiding dysfunction can actually lead to problem with kidneys. It can raise the pressure of urine inside the kidneys, will cause improper emptying of the kidneys into the bladder,
Right.
and can ultimately damage the kidneys also. So
Yeah.
this is just an example. Like you said, any problem that you're having, which if you're not convinced with the treating doctor, you can always seek advice from a specialist.
Absolutely. And I recommend that 100%. Uh, Now, in terms of the prostate cancer, in the event that, someone does have it, I know it's not one of those things that is, it's a final thing. And there are so many different treatments and different options. What are some of the things that could happen, and at what different are there different stages that things could be identified at, and is that what's crucial about it?
So, like we discussed, prostate cancer screening. Screening is meant for those who may not be having any symptoms, who may not be having any problems with the prostate, but we just routinely check it to detect the disease at its earliest stage. But a lot of time this happens with a person comes to us with lots of symptoms, and we find that there is prostate cancer, and it may be in different stages. We can find someone having prostate cancer limited to the prostate; it has just started. Someone may have it has just come out of the prostate, or may have spread to the local lymph nodes, or may have spread to the other parts of the body. So there's a whole range of presentations that we have. We call it stage of the disease. So for any cancer, we classify it based on its stage and grade. Stage means how much it has already spread in the body, and grade means how aggressive it is, how fast it's going to spread.
Okay.
So for prostate cancer, we have a whole spectrum of stage and grade at presentation. Grade can be from least bothersome, from least aggressive to the most aggressive form. We give it a number usually. For prostate, we give a number from 6 to 10. Like 6 is the least aggressive form of the cancer, and 10 is the most aggressive form of cancer.
Okay.
Similarly, for stage, we classify it into stages 1 to 4. 1 is within the prostate, just starting of the cancer. 4 is spread in the body. So depending on the grade and stage, we have different modalities of treatment. And one good thing about the prostate is, whatever the stage may be, we can absolutely control the disease. If the stage is limited, if it is within the prostate, we can completely cure the disease. But even if it is spread all over the body, we can very easily control it and give a good quality of life to the person for a number of years after that also.
Okay, and so and that's with prostate, primarily, right? So
Yes.
it's not one of the worst cancers then.
Yes.
Okay.
So if you talk of other cancers like lung cancer, blood cancer, colon cancer, so prostate cancer is like the least aggressive of all these. If all other cancers are lion, the prostate is a cat, you can say. So, but
If the others are a lion, that one's a cat.
Yeah.
Okay, I just want to say.
I love that analogy.
Yeah, right. I think also for that too, is it because why is that? Is it because of where it's located in the body?
so, like I said, it can have different presentations, different grades, but uh, why does it have different grades or different stages of presentation? We don't know. What we know is that once we have found it, if there is a small stage, if there is a less aggressive form of cancer, if it's 6 number prostate cancer, then we can expect it to behave very mildly. Even if we do not touch it like we do for people of 75 or 80, we do nothing if we find a cancer, prostate cancer,
Okay.
and they easily live for next 10 years without any problem.
Okay.
But if it is a grade 9 or 10, then it is not a cat, it is a tiger.
Right.
So
Okay.
that one we have to be aggressive about.
Okay, interesting. Tiffany, I'm sitting here and I'm just thinking, you and I have on essentially almost the same thing. You could just get on this side and just act as if you were the host, and I'll sit there.
That's true. I
'Cause we have
told you when
know-
I came, I don't know why you were following me while I was
Right?
dressing a red sweater, a bun,
Exactly, and
a little
glasses.
chain, glasses.
I think that's so funny, and I'm sitting here like, yeah, we could just switch places. That's very interesting. Now, sorry, Dr. Perez.
Yeah, we went astray with the topic there.
Because I was just thinking also as he is speaking, really. I know that when you came in, the president made jokes about you won the viewers and stuff of viewership, but you obviously you're quite comfortable on the radio, aren't you? This isn't your first rodeo.
Yes, that's what I am also surprised about.
Okay.
I have been usually very in school or in college. I've been very bad at stage performances.
Okay.
But I think this is my topic. This is my field. This
Okay.
is why I'm working.
Yeah, I think it's me too. I think.
Well, I think Dr. Perez, you know,
We make it
doing
comfortable in here, you know.
yeah,
It's
the
Star
topic that we're
Studio.
talking about, he's so
Yeah, he
fluent.
knows it.
You know it. You live it daily. You treat your patients, so it's just coming out of you.
Absolutely.
That that passion, you know,
Yeah.
it's
But
just
now that you
translate.
say, I think it's more of you then.
You think so? Oh, no, no, no. Now you're
You,
gonna say it.
you are so
No.
warm and you're so welcoming.
Oh, thank you. I
This is
appreciate
wonderful.
that. Really try to facilitate just a conversation because I really like, you know, just we're just sitting here talking about a subject you know about, and so the
Yeah.
listeners then are able to tune in and go, okay, yeah, I understand that. Oh, you know what? I heard that. I heard about that before. Oh, I had this issue. You know what? Let me go check this out. So that's kind of really how it should be come over the airwaves. You know, it's Movember. Movember, the month formerly known as November, and it's when brave and selfless men around the world grow a mustache and women step up to support them, all to raise awareness and funds for men's health, specifically prostate cancer, testicular cancer, mental health, and suicide prevention. It was established in 2003, as you mentioned earlier, by a few friends over a beer in a pub just outside Melbourne, Australia.
Typical males.
Yes, they saved the world over that beer, right?
Yes.
During November, men grew a mustache for the month. They get friends, family, and colleagues to donate, and they choose. Sometimes men choose to move or host the moment. They want men to take action to live happier, healthier, longer lives, and to do this by investing in these critical areas: prostate cancer, testicular cancer, mental health, and suicide prevention. Movember has created a movement of over 5 million supporters across the world, funding more than 1,200 innovative men's health projects across more than 20 countries. Prostate Cancer UK is the main beneficiary of the Movember campaign, and the amazing efforts of the Mo Bros and Mo Sisters from across the UK have significantly contributed to research initiatives and supported men by investing in its services. I mean, that's awesome, right? You know, to just to really just have created something like that for for men, right, to be aware. And because a lot of times, you know, you'll hear men saying, oh, everything is for women, you know, the attention is all in the women. And you know, it's because we're such social butterflies and you guys aren't. That's what it is, really. It's not anything biased. It's just that we like to talk, we like to talk to other women, we like to get together, and we like to try to save the world. And men are just like, I'm good over here. You know.
Men
And
also men also like to talk about women only. They
yeah,
don't like to
right.
talk about themselves.
There you go. And like I said, they don't necessarily like to go to the doctor also. But these are issues that need, a light shown on them, which is great. And we have somebody saying, great, Dr. Paras, Agora, Coley, or something is probably one of your fans or friends. Thank you so much for joining us this afternoon. Tiffany, who's the Global Sales and Marketing Manager at Health City, as well as Dr. Paras, who is the consultant urologist and kidney transplant surgeon. Yeah.
Mhm.
And we're chatting about November and observing men's health awareness because that's what we do in November. So thank you all so much for joining me this afternoon. We shall take a quick break, but we'll be back with more from your Straight Talk Drive at 5 show. This is Catherine Tyson, your host, and we'll be right back.
pancreas, we're concerned about thyroid, we're concerned about all the organs in the body working fine and to give you a good and a, a fit life. So uh, it's better to have a, a health check once a year, and that covers whenever you go for health check. PSA is a simple blood test which is usually included in all the tests that are done to look for your kidney functions, liver functions, cholesterol, lipids in the body, the thyroid function, and all the general checkup. PSA is also included in that. Just don't look for the prostate, look for your whole health in total.
Okay, that's a very, very, very good idea, good advice. And so that brings me to ask you then, Tiffany,
Mhm.
when you get an executive health check,
Mhm.
is that one of the things that's included? Let's talk a little bit about that.
Yes, it is. So the executive health check is one of the things that I think we've talked about that on almost every show because it hits on the full gamut of
Right,
health,
right.
regardless of what specialty area we're focusing on that week. So our executive health check. So Dr. Paraz just mentioned a bunch of those tests to do with prostate and so on. But just to give your listening audience a full um, picture of what that entails, it includes looking at your complete blood count, your blood sugar levels, your lipids. So that is looking at. I know Dr. Peraz, you mentioned lipids, but for the listening audience, you're probably trying to figure out what does that really mean. So it's looking at your total cholesterol, your HDL. So there is high density lipoprotein cholesterol levels, which is HDL.
Okay.
And then there is your very low density lipoprotein, which is the VLDL cholesterol levels. And then you have the triglycerides level, which is another type of fat in your blood. So you're just looking at the different levels, um, looking at that to make sure that you are in the correct zone that you
Okay.
need to be in. And then if there's anything that comes out of that executive health check that needs to be flagged, then the doctor will be able to say, look, this is too high or this is below the levels that it needs to be, and then what kind of plan do we need to put you on to ensure that you're in your optimal health.
Okay.
Then it also looks at your kidney function panel. um, I don't know if you want to go into a little bit what that entails, Dr. Peraz. But then you also look at uric acid and liver function panel as well. So it's a very all-inclusive kind of
Right.
look at
Yeah.
your body. The PSA is part of it for men, obviously.
Right.
And then I know we're focusing on men today, but for the female part of it, you look at the gynecological um, figures as well,
Ultrasound as
and the
well.
cervix, yeah, the
Yeah.
cervix and so on for a woman in the executive health check.
Okay.
So
So it's
All
a
right.
full look of the
Yeah.
entire system. You also do ECG, echocardiogram to test your heart. Um, and am I missing anything, Dr.
But when you
Perez?
look at him, I can't hear you.
Oh, I moved away from the mic.
Yes.
Sorry to your listening audience. I moved away from the mic. So I was just saying that we also looked at your heart rates, echocardiogram, just to ensure that that is also working
Right.
fine.
Right.
So basically, it is designed to have a look at your whole body and to detect any abnormality if it is happening, if it is starting to happen, to pick it up early and to manage it so that in the long term it does not affect you.
Okay. All right. So, Tiffany, I have a question then. How often do you recommend this executive health check? Since you just mentioned that, is that a yearly thing? Like
So
what is yeah?
yeah, well, we do
Or
have.
Dr. Paris can
Well,
tell
Dr.
us as well.
Perez, do you want to?
Since we
Yes,
have a doctor
we
in the house, we can.
Yes.
yeah we recommend it once a year.
Yeah,
Yes. So
because things can change.
yes, things can change. Things
Okay.
can change even earlier than that, because but uh, so these things are like when we check them and they're absolutely normal. We don't expect them to change very markedly in a year. And if we find something that we think it may change to worse before that, we will definitely advise you accordingly and call you earlier than that.
Okay.
But 1 year is the time that we generally ask you to have a test period again.
But so let me ask you, in terms of like an X-ray and stuff like that, is
Mhm.
that something that's okay for you to do every year? Like that's not, the yeah, that's what I want to know.
Yes. So see X-ray of I think only X-ray chest is the one which will be included in this test, and it's a very low radiation investigation.
Okay.
So normally, if you it's no small amount of radiation is always there in the environment. You're always exposed to very small amount of radiation, which is not going to harm you.
Okay.
So having an X-ray is like a minor addition to that radiation, and it's there is absolutely no chance. I mean, less than 0.001% chance that it can cause any problem.
Okay. All right. Just wanted to find out about that. Okay. So, Dr. Powers, let's talk a little bit about kind of maybe I have some notes here that was sent you guys sent to me. General physical health and obesity. We're talking about that in men as well, because we're obviously talking about men's health. So what are some of the things I think that people should be paying attention to in terms of that?
So general physical health, a lot of that we discussed with this executive health check plan. So we do a check of all the systems, all the organ systems with basic blood tests, basic investigations like X-ray, ECG, ultrasound abdomen. Uh, but one thing, important thing to discuss is obesity. Why it is important to discuss? Because
Right.
obesity is the leading cause of lifestyle-related deaths. So, like about 10, 15 years ago, it used to be cigarette smoking that was considered as a major lifestyle-related cause of morbidity and mortality.
Right.
Now it's obesity. Obesity causes cardiovascular disorders affecting heart, and can cause stroke. It can cause diabetes. It can lead to musculoskeletal disorders like osteoarthritis, your knees hurting, which is a major cause of morbidity and definitely affects your quality of life. It also leads to some cancers in the body, especially endometrium, that's uterine cancer,
Okay.
breast, ovarian, prostate, liver, gallbladder, kidney, colon. So all these organs are affected, are at more risk of cancer in an obese person rather than in a
Okay.
fit person.
Okay.
So
So paying
and
attention to that's important.
yes, so your weight is a good measure of your health. You should pay attention to that.
Right.
So for
Right.
that, we recommend to check your BMI. BMI you can easily check on any online. You can search on Google for BMI calculator. Just feed in your weight and height, and it will give you your BMI.
Okay.
BMI is body mass index. So we give it a number. If it is less than 25, you're good. More than 25 to 30, we call it as overweight group. Above 30, it's obese. So, just to give an example, if you are like 5 feet 6, then you should have a weight of less than 150 pounds or about 70 pounds or 70 kgs.
Okay.
If you are 6 feet, then it is advisable for you to be under 180 pounds or under 83 kilos.
Okay. Okay.
So, if you are heavier than that, then you should look at your weight and try and reduce it if possible. Uh, the easiest way, the best way, the best way to do is to take care of the calories you take in.
Right. Right.
It's basically the balance of calorie intake and calorie expenditure. It's difficult to uh, sometimes increase the expenditure, but definitely the calories you take in, you can have a good control over that.
Okay. So I think then the question I would ask is you've been here 9 months. Do you think we're a bit obese, a bit overweight? Kind of. You
Uh,
see more
there's a
occurrences of it.
we come again. I didn't
No,
catch
I'm
it.
just wondering if Cayman,
Okay.
just what you've observed with us, because I do think that we eat, we love food,
Yeah,
and we
Cayman has
love
a Cayman.
pastries and sweets, and we love this, and
Yes,
so
exactly.
yeah,
But Cayman has a mixed population. Like I see a lot of people running on the roads, jogging, and uh, I mean, being in a hospital is like a bias for me because a lot of people coming in are overweight and
right,
obese.
Yeah, but who you
because
see
they tend to
running is
get
not
more.
Caymanians. Well, they're Caymanians, but
Mhm.
do you know what I mean? Like I'm telling you, like for me, who I see running, and let me take that back. But I don't see like almost like it. I think for us, like indigenous Caymanians, are that's not our thing really to be like exercising. So I think intake is so important. Then if you're not like you just said, if you're not balancing it out with ensuring that you're burning the calories because you're
Yes.
getting them in but they're not getting burnt off and so they're becoming they're becoming fat in your body and then that's what's causing you a problem with all of these things that you just mentioned. Is that correct?
Yeah, just to give you an example, so like walking a mile will burn about 80 calories, 80 to 100 calories, and a hamburger that you eat with a single patty, that would be about 350 calories. So you'll
Right.
Oh,
have to
wow.
walk about 4 miles to burn that.
To
Good
burn that
grief.
off. Wow.
And we're not and that's a problem. So
Yes.
and the only reason listen, the only reason I'm actually saying this to you is because I did the executive health check a year ago in October of last year. And
Hmm.
it changed my life. It really did because I was starting to pay attention to my cholesterol, which was a little high, and then I went back in 5 months and I had gotten it down because I changed eating. I changed my eating. So that burger that I see that I want, I'm like, no, no, no. Every now and then I might, you know what I mean? Because I'm
Yes.
realizing that if I'm not if I'm not about to run 4 miles,
Yes.
then that burger is a no-no for me. That big plate of oxtail and rice and gravy and mashed potatoes and potato salad is delicious. It's amazing. But in order for me to get that off, I'm going to have to run, like you said, that 4 miles or something. And that's the problem. So, yeah, yeah, very, very important. So I'm just talking to my listeners here because I know, I'm speaking their language, right? I have a question here. Any specific symptoms? I'm thinking that might have been the question for the prostate. Maybe we were talking about.
Yes. I spoke on it a bit a few minutes ago. Basically, the initiation of cancer or the beginning of cancer, it does not usually have any symptom. Uh, but as it grows, it can make the prostate grow outwards or inwards. If it makes the prostate go inwards, then it will cause problems in urination. You
Okay.
have a difficulty in voiding. You may have to strain to pass urine. You may have more frequency, more times. You may have to get up in the night more often. Uh, but these all symptoms also happen because of BPH, benign prostatic hyperplasia. So it's not just specific to prostate cancer.
Okay.
Prostate cancer actually causes symptoms when it goes out of the prostate and then affects goes into bones or lymph nodes and cause bone pains, bone fractures, low back pain sometimes.
Right. Right.
So a lot of elderly men that they one of the I'll give an example. One of the patients that I saw, he came to emergency with unable to pass urine, and he complained of having low back pain for past few months.
Right.
And then we found out that he actually had a metastasized prostate cancer.
Wow.
Hmm.
So a cancer which started in the prostate, but then went out of it and spread to the bones, causing that low back pain which he
Right.
had for several months.
Right.
And now the prostate was so big in size that it caused total obstruction of the urine. So
Wow.
that's how we ended up in emergency.
Okay.
So that's one presentation of prostate cancer that
But
we
you were
get.
able to address it and
Yes, for him
okay.
also, we he was lucky to have a 7 number prostate cancer, so it was a lower grade.
Oh, good.
Okay,
So
that's
we
good.
could,
Okay.
yeah, so we
Yeah.
could control it well. He needed a small surgery to remove the enlarged part of the prostate,
Hmm.
and and after that he got radiation and hormone therapy to
Oh,
control the rest of the disease, and he would have a good quality of life and a
okay.
good life expectancy. I
Another
would say.
question. With prostate cancer at whatever grade and recovery, do men experience sexual issues after that? Is there, and I think that's one of the things on here as well,
Yes.
testosterone deficiency and sexual health.
Yes, exactly. So, relating it to prostate cancer, uh, the treatment of cancer, like I told earlier, the prostate is a reproductive organ. So, any fiddling with the prostate will lead to some issues. Uh, uh, so, especially when the cancer is in the beginning, when we are aiming to completely finish it off from the body, then we aim to either remove the whole of prostate or to give radiation to the prostate. So in that case, the nerves that are responsible for the sexual activity, the erection, they are just adjacent to the prostate and they get damaged. So people after surgery may have erectile dysfunction. I would say almost 90% people will have some erectile dysfunction, which recovers in about 50% of them in the coming year or 2 years.
Okay.
But the other 50% may need some other modalities to help with the erectile function after that.
Oh, okay. But there are things that will help as well.
Yes.
Yeah. So because
So
I think a lot of men are concerned about that, and sometimes they won't go to the doctor because they don't want to hear that, and that's like a catch-22. It's like not going to the doctor because you don't want that, and then that's exactly what's happening. And now it's gotten worse, and it would have been better had you gone earlier, right, for earlier
so the
intervention.
best thing is to go to a doctor, have a discussion, and then decide for yourself what you want.
Yeah, but don't be
You don't
afraid.
have to be afraid to talk,
Mhm.
but the decision will be yours. So it's always best to have a good knowledge of what you are having, what uh, what the treatment entails, what the disease entails, and to decide whether you want something or the other thing. We have different modalities of treatment, like I said. Surgery is one, then you have radiation as well, we have hormone therapy, we have different medicines for that. So what is good for you, that you have to decide after listening to us about all the side effects and the effects of cancer and the treatment modalities.
Yeah. Okay. So now, in terms of mental health and substance abuse and suicide prevention, are those kind of maybe your mental health is affected by having issues? You find that men do have that response more to when they have an issue or a serious issue.
So I think we are slightly changing the topics now from prostate cancer. We should do the rest. We should go on to the mental health
Right.
aspect of
Right.
uh,
What's male
men's life.
health, right? So we're talking about
Yeah,
male
we
health.
are
Yeah.
talking about men, so we have to talk about all the aspects of a man's life.
Right.
So
Right.
mental health is definitely a very major aspect of any person's life. For men, why is it important to discuss at this point is because uh, men are actually they don't come forward with their mental issues, with their emotional issues, or
Right.
what they're feeling. uh, Actually, if I quote some stats, about half of the men are embarrassed to discuss mental health issues even with
Right.
their friends,
Right.
and almost half also they admit that they feel more depressed than what they admit to actually.
Right.
So it's good to talk about this now.
Yeah.
um, it is estimated that about 1 in 8 men are at risk uh, are at risk for some mental health issues.
One in eight
One in
men.
eight, yes,
Okay.
maybe mild or moderate form of mental
Right.
health
Right.
issues, and
Right.
these issues can actually lead to higher risk of self harm, like alcohol or drug or
Right.
substance
Right.
abuse,
Right.
and also suicides.
Drowning your problems type of thing.
Yes,
Yeah.
that's what
Okay.
I think men would prefer to do rather than going to a doctor to talk about
Right.
it.
Because women will talk. We're gonna call. I'm calling Tiffany, and I'll be talking to her for an hour and a half about my problem. By the time I'm done, she's got it now. I'm fine. But men aren't doing that as much. Yeah.
Yes. So you don't have to go to a doctor to talk about it, like you said. You can talk to your friend, your family,
Absolutely.
anybody.
Yes.
Just come out to anyone, whatever you feel, whatever you're feeling. If you're not feeling good, not feeling well, if you're feeling hopeless or depressed or let down or any negative feeling that you're having, you can always talk to someone near and dear one.
Right.
That helps in venting it out,
Yes.
and a lot of times that only is enough for you to feel better.
That's right.
And
That's
but
right.
if it is persisting for some time, then is the time then you need some professional help.
Yeah, absolutely. And I think you're absolutely right with that because you from the time you see young boys and young girls playing and a young boy falls down, you'll hear even women, but you'll hear, get back up, you're no, 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 you're a tough boy, you're gonna be fine, no, no crying, don't cry. and a little girl falls down. Oh
Oh, the
no, come here. Oh my
baby.
goodness, it's gonna be okay. And
That's
so
true.
she's allowed to cry and have tears and have and be in pain, and the boy bleeding. Yep, I saw it on the internet the other night, like a two-year old
Mhm.
fell down, big scraped knee, and the father was like, "You a tough man, come on, get up, you'll be fine." And he was just like, the little boy was crying, laughing, like, and his little knee was bleeding.
Mm.
And I just thought, oh my goodness, and I love the balance, right? So I know a woman might have been like, oh my goodness, and make a big deal about it, and the man is like, let him be a man. But what does that really mean? So now you grow up, you're a grown man, and you don't want to talk about your problems. You don't want to come to sit down with someone. You don't want to go to a doctor. You don't want because you're a tough guy. That to me is the problem, isn't it?
Yes, exactly.
Yeah.
But I would like to add that this aspect of life is also true. Like when you are taught in the childhood that you are a man, you are a boy, you have to be a man. That is to prepare you to take care of your family, to take care of your near and dear ones, loved ones, because you have to be strong to keep your family happy and
Right.
to take care of your family.
Right.
But like you said, see, situations differ at different times, so all the time you do not have to be like that strong and that
Mhm.
Right.
obsessed about yourself.
Right.
I'd say.
What but I felt like you were going in this direction. So I'm going to finish what I felt you were saying, but you didn't say it. The fact that you were raised to take care of your family means that you need to take care of yourself in order for you to be able to take care of
Absolutely,
your family.
absolutely.
Yes.
Because how can you do that
if you're not well,
and then how
yeah,
can you do it if you're not here? If because of some
yeah,
reason of your own, something happens to you, who is going to take care of your family? So there's that. So I
definitely.
absolutely think that is great. Thank you all so much for joining me this afternoon. You have any final thoughts, or did we cover everything?
I think we covered everything. It's funny when Dr. Perez was talking about the body mass index. He started off specifically saying, for example, if you're 5 feet 6 inches, which I am, so I was listening very, very keenly
Yeah, and
to
I know,
see
and I
what
was
my weight was
I was
supposed to
I was
be.
trying to calculate because I'm a little taller, so I was just
Yeah,
like, okay,
trying to figure out what is if he's gonna what's gonna come up for
right.
mine. But
How are you? Were you good?
yes, I
Okay.
was within I
Okay.
was within it, so that's good.
Okay.
But I just want to say thanks again for having us. Thank you, Dr. Perez, for coming down. Our doctors are pretty busy people, and
Yes.
so making an hour out of your schedule to come down to share with the Cayman Island community, well, it's on Facebook streaming, so
Right.
whoever else is listening anywhere
Right.
in the world
Oh,
as
it'll be
well.
the Indian community later. 1,000 views.
Yeah, 1,000 views for Dr. Perez's fans.
Right.
But just want to say thanks for having us. And if anybody wants to consult again with Dr. Perez or or if you want to make an appointment to have our executive health check done, please feel free to email us at info@healthcity.ky or give us a call at 640-4040.
640-4040.
Yep.
It's so easy to remember. Thank you all so much for joining me this afternoon. It is Medical Mondays. It's brought to you by Health City. This has been your Star 92.7 Straight Talk Drive at 5 show. I am your host, Catherine Tyson, and it is always a pleasure to catch up with you, Tiffany, the global sales and marketing manager at Health City, as well as any doctor that you bring along with you this afternoon, being Dr. Paras. Thank you once again for joining me and for being, it's just so informational about all of this stuff that I think our men need to hear, our women need to hear, to take care of their fathers and their uncles and their grandfathers and their husbands and all the men in their lives, to keep them healthy and, because health is your wealth, right?
Definitely.
This was right.
Thank you all so much once again for
Thank you.
joining me this afternoon. I hope you're either at home or you're almost there. You have a great evening, and we shall talk again. Take care.